2 million Americans are diagnosed with skin cancer each year. That makes it the most common form of cancer. About 68,000 of those patients have melanoma, the deadliest form of the disease. KHQA's Jim Whitfield spoke to a patient who caught the problem early. Here's a look at the importance of early detection in this KHQA Safe Family Health Report.
Marisa Ellison runs several long-distance races a year. She loves being outdoors and she loves the sun. And she says growing up, her fair skin suffered plenty of sunburns.
Absolutely. I remember being burned so bad that it was purple. Almost my entire childhood. We never wore sunscreen when we were kids. And as I got older, obviously, I started putting the sun tanning oil on and getting as dark as I possibly could every year.
Ellison said she first noticed a problem on the lower part of her leg back in January. She said she thought it would go away.
So I showed a couple people and they're like, yeah, and I said, yeah, I think it's suspicious. So I went in and he did a biopsy, and the next day they told me that it was basal cell carcinoma and it had to be removed.
Dr. Susan Meidel has been in practice at the Hannibal Clinic since 1969. She says she has seen people as young as their early 20s on up to their late 70s suffering from skin cancer. Statistics show about 1 in 5 Americans will be diagnosed with some form of skin cancer in their lifetime.
We are seeing an increased incidence of skin cancer, including melanoma in the United States, and that's likely related to sun exposure and also tanning bed use. So it is becoming a more common problem, but as long as I've been in practice, it's been fairly common.
Coming up tonight at 10, I'll visit with a local dermatologist to undergo a skin cancer screening to see what kind of damage the sun has done to my skin. I'll also have some tips for people on what they can do to minimize the damage the sun does to their skin when you're outside working or having fun.
In other health news, many of us use hand sanitizers to kill germs and prevent infections from spreading.
You're watching KHQA's Late News.
Within a month, swimming pools will be open, golf courses and tennis courts will be packed, and parks will be crowded. All signs of summer fun and higher risk for skin cancer. Many adults probably spend their childhood playing outdoors without sunscreen, and that means sun-damaged skin today. Jim Whitfield recently visited a Quincy dermatologist for a skin cancer screening. The results were surprising, as you'll see in this KHQA Safe Family Health Report.
When you're 16 or 17 years old, getting a job as a lifeguard was like hitting the jackpot. But 30 years later, sun-damaged skin is beginning to show and cause concern for many of us. I went to Blessing Hospital to have my face checked by an ultraviolet skin scanner machine. And what I discovered was surprising. All the black freckles indicate sun-damaged skin, and those spots are not visible to the naked eye.
What worries me the most is that you were a sun worshiper for years, so you were outdoors as a lifeguard. So we know you have sun-damaged skin. You tell me you have not been the best at using sunscreens, so you need to be real good about using a sunscreen.
I asked Dr. Louis Quintero to check my face, neck, arms, and ears for anything suspicious. It's a routine skin cancer screening that can easily identify moles and other spots which could be cancerous. Sure enough, Dr. Quintero found a few spots that needed to be looked at more closely.
You definitely have some sun-damaged skin. It's not real bad. You've had some precancerous spots like you mentioned before on your leg. You have a little precancerous spot here that needs attention. You do have some sun damage on your ears and the cartilage of your ears, and mostly on your face. Your arms look pretty good.
So what I found out from my visit to Dr. Quintero were two things. One, UVB rays from the sun causes you to get sunburned, but it's the UVA rays that causes skin cancer. So when you're buying sunscreen, make sure to get a lotion that protects you from both. And if you're outside a lot, playing golf, swimming, and even if your job requires you to be outside, the doctor recommends a wide-brimmed hat as opposed to a baseball cap or a visor. Now, the ball cap will protect your forehead and the area around your eyes, but nothing else. While the wide-brimmed hat, well, that's going to protect your neck, ears, and face.